6. Peripheral artery disease. Peripheral artery disease, PAD, also known as peripheral vascular disease, PVD, is a common circulatory condition in which narrowed or blocked blood vessels restrict blood flow to the limbs, most commonly the legs. This reduction in blood flow can lead to a variety of symptoms and potentially serious complications. Here are key points to understand about peripheral artery disease. Causes: peripheral artery disease is primarily caused by atherosclerosis, a condition in which fatty deposits, cholesterol, and other substances plaque build up within the arteries, narrowing and hardening them. Over time, this narrowing limits the amount of oxygen-rich blood that can reach the muscles and tissues in the affected limbs. Risk factors: several factors increase the risk of developing PAD, including 1. Smoking. 2. Age, especially those over 50. 3. Diabetes. 4. High blood pressure, hypertension. 5. High cholesterol levels. 6. Obesity. 7. Family history of PAD, heart disease, or stroke. 8. Sedentary lifestyle. 9. Chronic kidney disease. Symptoms: PAD often presents with symptoms related to reduced blood flow in the affected limbs. Common symptoms include 1. Claudication, pain, cramping, or discomfort in the legs during physical activity, which improves with rest. 2. Numbness or weakness. 3. Cool or pale skin. 4. Hair loss. 5. Skin changes. 6. Gangrene, tissue death. Treatment: the management of PAD aims to reduce symptoms, improve quality of life, and prevent complications. Treatment options may include 1. Lifestyle changes: smoking cessation, regular exercise, and a heart-healthy diet are essential. 2. Medications: medications may be prescribed to manage blood pressure, cholesterol, and blood sugar levels. 3. Antiplatelet drugs, such as aspirin or clopidogrel to reduce the risk of blood clots. 4. Vasodilators, medications that widen blood vessels. 5. Angioplasty and stenting, a minimally invasive procedure to open narrowed arteries. 6. Surgery: in severe cases, bypass surgery may be necessary to reroute blood flow around the blocked artery. 7. Coronary artery disease. Coronary artery disease, CAD, also known as coronary heart disease, CHD, or ischemic heart disease, is a common and serious cardiovascular condition. It occurs when the blood vessels that supply oxygen and nutrients to the heart muscle become narrowed or blocked, usually due to atherosclerosis. Here are key points to understand about coronary artery disease. Causes: atherosclerosis. The most common cause of CAD is atherosclerosis, a condition in which fatty deposits, cholesterol, calcium, and other substances build up in the coronary arteries, forming plaques that narrow the arteries over time. Risk factors: several risk factors increase the likelihood of developing CAD, including 1. Smoking. 2. High blood pressure. 3. High cholesterol levels. 4. Diabetes. 5. Obesity. 6. Sedentary lifestyle. 7. Family history of heart disease. 8. And age: risk increases with age. Pathophysiology: atherosclerosis reduces the blood flow to the heart muscle. Plaques can rupture or become inflamed, leading to the formation of blood clots, thrombosis, that can partially or completely block the coronary arteries. Reduced blood flow deprives the heart muscle of oxygen and nutrients, which can result in chest pain or angina. If a coronary artery becomes completely blocked, it can lead to a heart attack, myocardial infarction, which is a medical emergency. Symptoms: 1. The most common symptom of CAD is angina, which is characterized by chest pain or discomfort that may radiate to the neck, jaw, shoulder, back, or arm. Angina often occurs during physical exertion or emotional stress and typically improves with rest or medication. 2. Other symptoms may include shortness of breath, fatigue, weakness, and palpitations. 3. In some cases, CAD can be asymptomatic until a heart attack occurs. Treatment: Treatment aims to relieve symptoms, reduce the risk of complications, and improve overall cardiovascular health. 1. It may include lifestyle changes, such as adopting a heart-healthy diet, regular exercise, smoking cessation, and stress management. Medications, including statins, to lower cholesterol, antiplatelet drugs, to prevent blood clots, and medications to manage blood pressure and control angina. Revascularization procedures, such as angioplasty and stenting, or coronary artery bypass grafting, CABG, to restore blood flow to blocked arteries. 2. Secondary prevention measures are essential to manage CAD risk factors and prevent disease progression. 8. Chronic stable angina. Chronic stable angina, often referred to simply as stable angina, is a common form of chest pain or discomfort that occurs when the heart muscle doesn't receive enough blood and oxygen due to narrowed or partially blocked coronary arteries. Unlike unstable angina, which is more unpredictable and considered a medical emergency, stable angina typically follows a consistent pattern and is brought on by specific triggers, such as physical exertion or emotional stress. Here are key points to understand about chronic stable angina. Causes. Chronic stable angina is primarily caused by atherosclerosis, a condition in which fatty deposits, cholesterol, and other substances build up in the coronary arteries, reducing blood flow to the heart muscle. When the heart's demand for oxygen increases, such as during physical activity, the reduced blood flow can lead to angina symptoms. Symptoms. The hallmark symptom of chronic stable angina is chest pain or discomfort, which is often described as a tightness, pressure, squeezing, or burning sensation in the chest. The pain may radiate to the neck, jaw, shoulder, back, or arm. Other common symptoms may include 1. Shortness of breath. 2. Fatigue. 3. Nausea. 4. Sweating. Triggers. Stable angina typically occurs predictably in response to specific triggers, known as precipitating factors, which increase the heart's workload and oxygen demand. Common triggers include 1. Physical exertion or exercise. 2. Emotional stress or anxiety. 3. Exposure to cold temperatures. 4. A heavy meal. 5. Smoking or exposure to tobacco smoke. Relief. Rest or the use of medication, such as nitroglycerin, typically relieves the chest pain associated with stable angina. Rest reduces the heart's oxygen demand, while nitroglycerin helps dilate the coronary arteries, increasing blood flow to the heart muscle. Treatment. The management of chronic stable angina aims to 1. Relieve symptoms. 2. Prevent or reduce the frequency and severity of angina episodes. 3. Reduce the risk of cardiovascular complications. Treatment options may include 1. Lifestyle modifications, adopting a heart-healthy diet, regular exercise, smoking cessation, and stress management. 2. Medications, nitroglycerin, beta blockers, calcium channel blockers, and antiplatelet drugs may be prescribed. 3. Revascularization procedures, in some cases, angioplasty and stent placement or coronary artery bypass grafting, CABG, may be recommended to improve blood flow to the heart muscle.